So chapter 14 discusses antidepressants, psychomotor stimulants, and lithium. This is a rather long chapter, so it might get split into two different videos, just to let you know. So starting off on after the learning outcomes, the different types of depression, because there is more than one type. Exogenous or reactive can be caused by external factors such as death in the family or unemployment. Usually that's a situation that somebody's reacting to, so that's called reactive. Exogenous meaning external, something they can't control. The second major type of depression is referred to as major depressive disorder, and it is frequently more serious and requires both psychotherapy and drug treatment. This type of depression originates from within the individual, and again, isn't something they control, but isn't necessarily determined by external factors. Depression is linked to low levels of norepinephrine and or serotonin. So what causes depression is the low levels of those neurotransmitters. In some cases of depression, people alternate between periods of hyperexcitability and elation, known as mania, back down to the depressed, not wanting to do anything. That is called bipolar mood disorder when they alternate between those cycles. So let's see. Moving on to drugs that treat depression. Drugs that increase the level of norepinephrine and serotonin are used in the treatment of depression. The major classes are serotonin reuptake inhibitors, also called selective serotonin reuptake inhibitors, atypical SSRIs, which not only work on serotonin but also norepinephrine receptors, tricyclic antidepressants, and monoamine oxidase inhibitors. So let's start off with selective serotonin reuptake inhibitors. They block the reuptake of serotonin back into the serotonergic nerve endings, which means that serotonin is able to stick around for longer and more is available to work on the system. SSRIs are the preferred treatment for major depression, but they're also effective for other problems such as OCD, anxiety, post-traumatic stress disorder, used for a lot of different things. All of the SSRIs cause GI disturbances, including nausea, diarrhea, dry mouth, and anorexia. They've also been associated with sexual dysfunction, which is a common reason that a lot of people don't want to take them. Other CNS side effects include headache, nervousness, insomnia, and tremors. So on slide 10, there's a chart talking about the drug names, as well as the dose ranges. Again, don't focus too much on those, in addition to the CNS activating level, okay? Moving on to the atypical SSRIs. They still block the reuptake of serotonin, but they also act on other neurotransmitters as well, primarily norepinephrine. Sometimes these are called SNRIs, selective norepinephrine serotonin reuptake inhibitors, long names. Like the SSRIs, they have little effect in blocking cholinergic, adrenergic, or histamine receptors. So drugs in this class include, but are not limited to, bupropion, which we might have already talked about for smoking cessation, desvenlafaxine, duloxetine, mirtazapine, nifazodone, trazodone, and venlafaxine. Very similar to our SSRIs, just a little bit of a different approach. Tricyclic antidepressants are drugs that block the reuptake of norepinephrine and serotonin back into the neuronal nerve endings. Tricyclics are named so because of the characteristic triple ring structure that they possess. So they produce varying degrees of sedation, anticholinergic effects, and alpha adrenergic blockade. So again, we get into a lot of those side effects that may be unpleasant for the patient. On slide 14, a list of the various names. Amitriptyline being the drug of this class that is used the most commonly. Very commonly seen, the go-to tricyclic antidepressant. So drug interactions, there are quite a few. You can read through that list and get an idea that we might not always go to this class first, just because of the drug interactions that it possesses. Sometimes, and as well as the sedation and the other side effects, sometimes we'll stray towards other classes. But if we thought that one had a lot of interactions, moving on to monoamine oxidase inhibitors, also referred to as MAOs or MAOI for inhibitor. MAO is an enzyme found in adrenergic and serotonergic nerve endings. Normal function of MAO is to break down norepinephrine and serotonin. So if we inhibit MAO, we leave more norepinephrine and serotonin around. In mental depression, there appears to be a decrease in the brain levels of serotonin and norepinephrine. So the more we leave around, the more likely we are to treat our depression. Problem with these is that there are many drug interactions as well as food interactions. So people have dietary restrictions when they're taking these medications to include wine, beer, certain cheeses, certain meats. Adverse effects include dry mouth, urinary retention, low blood pressure, restlessness, and seizures. In addition, there are a ton of drug interactions, so we do have to be careful with those medications. Finally, they can produce a type of liver damage that may be fatal. So these patients are usually on a lot of monitoring. So there are only 3 drugs in this class: Marplan, Nardil, and Parnate. Don't worry about the dosage ranges, just become familiar with those names. Anytime you see them, you want to make sure that your patient is safe and not on any other drugs that have interactions. Psychomotor stimulants include the amphetamines and other closely related drugs. These are used for ADHD. They stimulate the central nervous system by increasing the activity of norepinephrine and dopamine in the brain. They're not really antidepressants. They're primarily used for children with attention deficit hyperactive disorder. So amphetamines are controlled substances. They're C2s, the highest class of controlled substances that there are. So again, they can have dependency and tolerance problems, and they also can have abuse and deterrent problems. People want to get their hands on them for the wrong reasons. So disadvantages, like I just mentioned, dependency and tolerance, increased activation of sympathetic nervous system, so dry mouth, rapid heartbeat, increased blood pressure, restlessness, and insomnia. Now, in adults, we might not worry about some of these things, but for our children, we worry about increasing their heart rate or increasing their metabolism. Sometimes these kids are so tiny already, and we're giving these drugs that just speed up everything, and they stay tiny, they stay skinny, they stay under height and underweight. But however, it does allow them to function as a student or be a better behaved child. There's a lot of debate out there as to ADHD. Do as many kids have it as we diagnose, and are we using these medications correctly? Because they do come with a lot of side effects. Slide 22 shows the different amphetamines that are out there. Again, don't worry about the dose range, and lucky for us, almost every single one of these sounds like amphetamine or something close to it. So that's how you remember that these are stimulants. They can produce, because of the CNS stimulation, they can produce at toxic doses agitation and a paranoid type of psychosis. So we always want to make sure we have our dose sort of dialed in and correct for our patients. Lithium. Lithium is used in the treatment of mania and bipolar mood disorder, often combined with other antidepressants to treat that swing from depression to mania. Both lithium and sodium, Li+, Na+, you'll see it in the book, exist in the body as charged particles. However, whereas sodium is normally required for conduction of nerve impulses, lithium interferes with nerve conduction. As a result, there's a decrease in the excitability of nerve tissue. Lithium is administered as a salt, lithium carbonate, Escalith and Escalith CR. And it usually requires 1 to 2 weeks of treatment before an effect is seen. And people do have to have their blood levels monitored because it can cause toxic levels that cause heart and kidney damage. Side effects include nausea and tremors. Signs of overdose include vomiting, ringing in the ears, and frequent urination. I thought this chapter would go a lot slower, but apparently it didn't. Went pretty quick. So that covers chapter 14. Next we'll be moving on to 19 and 20. And let me know if you guys have any questions on this chapter, because antidepressants are one of your more common medications that you'll see a lot of different patients on. Okay?